All right, let's talk about the pelvic girdle. So the pelvic girdle, we do often just refer to the entire kind of structure as the hip bones, but there's obviously more involved than that. But we're specifically here going to talk about what we consider the hips, because we've already been through the sacrum and the functioning part that is actually structurally more similar to the spinal column than to the legs, essentially. So there are several functions of the pelvic girdle. It, of course, transmits your weight of your torso to the ground. It protects the very important pelvic viscera on the inside. And it anchors the muscles of the perineum, or the anogenital region. So this area actually has very complicated musculature. We are going to learn about a few of them. And the anchoring of these is important both for basically movement of your body and protecting your innards. The bones themselves include your right and your left os coxae. So singular for this is os coxa. These are often referred to as your innominate, which actually means no name, but they do have a name. It's os coxa or os coxae. So your right and left os coxae. Then the entire girdle, as I mentioned on the previous slide, does include your sacrum and your coccyx, which are functionally and structurally closely related to your spinal column. So we've already talked about those. The sacrum does articulate with each os coxa or each coxa at your sacroiliac joints. So sacro or sacroiliac, your sacrum plus your ilium make up that word for sacroiliac joint. And your coxae articulate with each other at your pubic symphysis, which is here. As we get into more details about these bones, we kind of speak of them regionally, which you'll see what I mean, but they do have these particular articulations, and really the only place the two of them articulate with each other is at this pubic symphysis on your pubis. The major feature that you see first when you look at one of the os coxae is the acetabulum, which is this circular feature here that forms part of the hip joint. It accepts the femoral head, and it has a cartilaginous labrum like the shoulder joint to help basically deepen this pocket so that the femoral head can sit more snugly in there. So here's the cartilaginous lip or labrum here. And even extending this cartilaginous labrum, we'll see on the next slide or a slide later, the iliofemoral ligament. I feel like I said ligament. I'm going to leave it because it sounds kind of funny. The iliofemoral ligament, but really ligament, extends this cartilaginous labrum to really hold your femoral head very firmly in this socket while being incredibly flexible as well. So here you can see a little bit more about that iliofemoral ligament, how it runs from the border of the acetabulum over to the femur here and keeps the femoral head in place. There is also a bursa here upon which muscles slide that I will tell you more about in a minute. A little bit more information about the acetabulum. The articular surface within it is called the lunate surface because, you guessed it, it's shaped like a moon. So here's the lunate surface here. That's the actual articular surface of the acetabulum. And that deep central portion is called the acetabular fossa. So this indentation here, and what it does is actually house a ligament called ligamentum teres. And ligamentum teres comes up through here from this soft tissue feature here, comes up out of that acetabular fossa, and then will eventually go back into or go into the head of the femur and bring a nerve and an artery with it. So that ligamentum teres connects the head of the femur itself within that acetabular fossa, and the iliofemoral ligament is the one that kind of cups the whole joint outside. So here's some arrows for the ligamentum teres. When we look at the os coxa as a whole, we can divide it into three actual separate bones. The ilium is the superior bone, so it's shaded here in yellow. The ischium is posterior to the acetabulum, it's shaded here in blue, and the pubis is anterior to the acetabulum, it's shaded here in pink. Now, these three bones fuse together permanently in adults, so you do not find them as separate pieces unless they break. But developmentally they are separate, so we talk about them as separate bones, I guess you could say, or separate features of the bone. And we will learn the features on these individual parts of the bone. I believe they are shaded the same in all of the slides. The ischium and the pubis together join to form this heart-shaped foramen here, the obturator foramen. It is covered by a soft tissue structure completely. I asked my friend Christy, who studies pelvis structure and morphology, I said, why is the obturator foramen so big if it's just basically covered by soft tissue? And she said, I don't know. That's a good question. That's the end of that story. So a quick question, where is the acetabulum on the pelvis, the ilium, the ischium, the pubis, or all of the above? And then when we look at this mid-sagittal section, so midline sagittal section, this is basically the anterior of a pelvic girdle over here, the posterior of the pelvic girdle over here. So what we do here is have a section, a cross section that's through the sacrum posteriorly, and then here is where the pubic symphysis would be anteriorly. And when we look at it this way, we can see that we can actually talk about the pelvis as a whole in two different ways. There is the greater pelvis, which is sometimes called the false pelvis, and then there's a lesser pelvis, which is sometimes called the true pelvis. And the greater and the lesser pelvis are divided by this line here, which I'm going to give you names of in a minute. But something else to keep in mind about these is that this true pelvis, this lesser pelvis, the lower part, is the actual bowl shape that your viscera are sitting in. So this is literally holding guts, versus the greater pelvis basically includes these iliac blades, the blades of your ilia as they're sweeping out. This part is also holding your guts, but you can think of that as more of kind of the structure of holding your body up rather than the bowl that actually keeps your guts and babies, if you were to be pregnant with one, in place. That's what the lesser pelvis or the true pelvis does. So that line that I had highlighted on the previous slide is called two different things. It's called the arcuate line or the pectineal line. And the arcuate line is the iliac portion of this overall line, and the pectineal line is, or the pectinate, is the pubic portion. So basically this is the line that runs here. It is an actual crest that you can feel that runs across the pubis. We call it the pectineal line here. And then once you reach the ilium, it's now called the arcuate line. And together that line divides the greater or the false pelvis up here from the lesser pelvis, which is the bowl down here. The bowl for your guts. So if we're looking specifically at the ilium, we can look at features both medially and laterally. So medially are going to be the inner features, the features that are inside your body that you cannot touch even if you tried. But if you do, don't try that. There is the anterior superior iliac spine, and luckily it's telling you exactly where it is. It's both anterior and superior. It's this spine here. This is for the attachment of the inguinal ligament, and I'm going to come back to what the inguinal ligament is in a moment, but just remember that the inguinal ligament attaches here. There is also the anterior inferior iliac spine, so it's on the anterior portion and it's inferior. This will be attachment for rectus femoris muscle groups. This is part of the quadriceps group. And sorry, I said that a little bit wrong. This is for attachment of the rectus femoris muscle, which is a part of the quadriceps group. And I'll come back to what the rest of the quadriceps are eventually, maybe in the femur. There's also the iliac tuberosity, which is highlighted here, along with the auricular surface, which is highlighted here. Now, the auricular surface is the actual joint surface for the sacroiliac joint. So auricular means ear-shaped. We've had an auricular surface on something else previous. So this ear-shaped articular surface is for that sacroiliac joint. Now this is not a joint for which there should be movement, so this isn't a smooth articular surface. This is a joint where there's not supposed to be movement, so it's actually a rougher articular surface to hold on tight to the sacrum. That iliac tuberosity right behind it is simply kind of a roughened portion that you can feel with your thumb. There's not really a particular function of that. It is just basically posterior to that sacroiliac joint. Now, I mentioned on the previous slide the inguinal ligament, and what you can see here, and also on a previous slide before that, we saw some other things. What you can see here is a muscle group that comes down the iliacus muscle. It's going to come down from the ilium. We might get to that again. And then there is the psoas muscle that comes actually from your spinal column, and together they actually join to make the iliopsoas muscle, which wraps around your hip to eventually attach to the back of your femur. Now, importantly here, is not really necessarily where the iliopsoas comes from or goes, it's where it sits in this hip joint. So this bursa that we talked about earlier, a bursa is just kind of like a gel-filled sac that helps muscles kind of move smoothly over other features. So this is kind of what keeps your muscle from kind of getting ragged against the iliofemoral ligament. So this bursa sits on the iliofemoral ligament, the iliopsoas muscle wraps around it, that bursa helps kind of smooth it around, keeps it from getting caught on things as you move, so that this set of muscles can be one of the major movers or flexors of your hip. Now, where does the inguinal ligament come into this? Sorry if I just got cut off. Where does the inguinal ligament come into this? Here you can see this is the superior or anterior superior iliac spine. Here's the inguinal ligament. We are going to see a little bit later the other half attachment point where it comes down here to the pubis. But this inguinal ligament helps keep things like your iliopsoas muscle in place. You can feel your inguinal ligament if you kind of poke around. This is also a place in several areas that is kind of a place of weakness in your body, and so when you get a hernia, especially if you are born biomale, if you get a hernia, it's often kind of involved with this inguinal ligament. There's an inguinal canal where there are weaknesses and kind of guts can pop through when they're not supposed to. So that's what a hernia is. So again, this is the anterior superior iliac spine for this inguinal ligament that comes across and helps keep things in line, and also has a very close relationship with your gonads. I mean, there's a lot to learn that we are not going to learn. So some more features of the medial part of the ilium. There is also what we call a pre-auricular sulcus. So this is again a ditch. A sulcus is kind of like a ditch that's right in front of that auricular surface. So here you can see that ear-shaped auricular surface. That's the sacroiliac joint. You can also feel it. These are things you can feel with your thumbs. And then that ditch right in front of it is the pre-auricular sulcus. Sorry. We also talked about the arcuate line already on the ilium, which will eventually also kind of turn into the pectineal line on the pubis. But before we get to the pubis, there is something called an iliopubic eminence. This is again something you can feel with your thumbs. This is an eminence that does kind of stick off from both the ilium and the pubis and where they join together, and really that's what it is. This is where the ilium and the pubis join together here on the top. Again, it's like a ridgy spot that you can feel with your thumbs. On the outside of your ilium, the lateral features include your iliac crests, which are important spots for attachment of muscles. We will come back to some of those attachments a little bit later. You also have your iliac spines. We've already talked about two of them, the anterior superior and the anterior inferior. Anterior superior was for that inguinal ligament. Anterior inferior was for one of the quadriceps muscles. Posterior superior here, posterior inferior here. We'll come back to those and what they're important for. But also something that you've probably all heard of is the greater sciatic notch here. Your sciatic nerve runs through this notch, so it's important for a variety of reasons, but it's also one feature that we use when we're trying to sex the skeleton. The wider the notch, the more likely it is that the pelvis is from a bio female. Looking at some more of these lateral features, these again, I have a drawing here because some of these are a little bit easier to feel than see necessarily. The iliac pillar is one of these. It's kind of a thickening of the ilium towards the front. I can kind of see where you would feel it on this picture, like you can see where the shadow changes a little bit. You could feel this with your thumb. And that iliac pillar leads up to what's called the iliac tubercle, which on this drawing is this feature here. Again, that's kind of exaggerated in the drawing, and I would say that in this picture over here, it doesn't come down quite so inferiorly. So up here, it's kind of more up. I think this over here is the pillar, which up here is going to be some tubercle features. But again, these are going to be things that you can feel probably a little bit more clearly than you can see. So the ilium itself is pretty ridgy. There's a lot of features and a lot of, bumpiness that will help you, if you were to have a chunk of it, would help you know which part of the ilium you have. Ah, there's the highlighted iliac tubercle, sorry. Of course, some of the most important lateral features are for attachments of muscles that if you've taken any classes with me, you've heard some about before. So we have the gluteal lines, or the gluteal lines, are for attachments of the gluteal or gluteal muscles. You can say it either way. That blue line is the posterior gluteal line. The anterior gluteal line is in green, and the inferior gluteal line is in orange. So this is one of these ones that kind of bugs me because I don't feel like these three directional words go together very well, because you have posterior, anterior, and then inferior. So you just got to learn these. I feel like posterior, anterior, I feel like the inferior doesn't really go with them. But these are for attachments of gluteus maximus, medius, and minimus. In the next slide, I have more clearly where they're attaching, but these are both lines that you can see and that you can feel. So you remember the posterior is the most posterior, anterior is the one that's in front of that, and then inferior is the most inferior. So here's another look at these gluteal lines. The gluteus maximus actually attaches posterior to that posterior gluteal line. Medius is in between the posterior and anterior, and then minimus is in between the anterior and inferior gluteal lines. Now, just to remind you, the reason you've heard me talk about these before is these gluteus muscles are what keep your torso upright on your legs. So these are what are basically extending your hips, keeping your torso up. These are extremely important for bipedality, especially keeping your body basically stable on one leg when you're taking a step. So when you have one leg in the air as you're swinging, it's your gluteal muscles that are firing. And so the shape of your ilium is what allows these gluteus muscles to act in the way they do during bipedality. And so this is one reason we talk about them a lot, that chimps have very differently shaped pelvises, because these gluteal muscles don't act in the same way. So these are pretty important for human evolution and for humans in general. This is a unique kind of shape and size for the attachments of these gluteus muscles. The pectineal line is primarily on the ilium, ischium, or pubis, so think about that for a moment. And moving inferiorly and posteriorly to the ischium, there is the body of the ischium, which is just the main chunk of it. On that body, there is an ischial spine, and I have these numbered, but if you look very closely, the different views have different numbers, so be careful if you're looking at the numbers. I have these on other slides as well, like number 9 here. Just be careful if you're using those numbers, and pay attention to where the arrows are. There's a lesser sciatic notch, which is highlighted here in yellow below that ischial spine. The sciatic nerve actually wraps around here too. And then there is ischial tuberosity here, and the inferior ramus down here. Now, a ramus in general is I think of it as a reaching arm, or you can think of it as a reaching bridge. So we've seen a ramus on the mandible. We've seen, where else have we seen a ramus? I can't think of another one right now, but we see this ramus, and then we're gonna see another one pretty soon. And I really do think of it as this kind of long reaching arm or reaching bridge. So this inferior ramus is beneath, it's bridging from the ischial tuberosity to this anterior feature, this anterior bone over here that we'll talk about a little bit later. And we've talked about ischial tuberosities before. So on the ischium itself, the body is the whole thing. It's just the word for the whole thing. And you have this ischial spine, the lesser sciatic notch, that tuberosity, and that inferior ramus. A few more views on this. The ischium, our ischial spine, here you can see here. The lesser sciatic notch is just beneath it, and then the ischial tuberosity down here. Now I do want you to take a moment and maybe pause and just look at these. I'm not going to tell you which direction they're facing, but look at these os coxae and orient them in your mind so that we know what we're looking at, that you know what you're looking at. You will remember that ischial tuberosities, potentially you'll remember, I talk about them when we talk about monkeys, because African and Asian monkeys have ischial callosities right here, and that's what they sit on hot rocks with. So that will help you remember maybe where's that ischial tuberosity is. That's what will touch the seat if you didn't have muscles in between your bones and the seat. Here is more about that ischial tuberosity. It is in this position down here on your ischium, so this is the ischial tuberosity here. And on this dorsal surface, or on the posterior surface, this is where your hamstring muscle group attaches. And on the anterior surface, or the ventral surface, you have attachment for the leg adductor muscle groups. So adductor means adding to, so bringing legs together. So what I mean by ventral surface is, so here's the posterior dorsal surface. The way it twists a little bit, it's actually kind of on the other side. It's the surface that you can't really see when you're looking at this particular picture. It's on the other side, the ventral side, where you would kind of poke your finger around to touch. That's where those adductor muscles attach, and the adductor is adding your legs in, so bringing your legs closer together. So if you think about muscles attaching here at the underneath of your ischium, and if you pull them, it brings your legs in. And the hamstrings run down the back of your legs. A few important soft tissue ligaments. The sacrotuberous ligament runs from your sacrum to your ischial tuberosity. So this is another important structure that runs to your ischial tuberosity. And your sacrospinous ligament runs from your sacrum to that ischial spine. So I really love looking at the soft tissue features, these ligamentous features of the pelvis, because there are so many of them and they crisscross and they're so complicated to basically keep these structures really solid. I don't want to say solid, solid's not quite the right word. Keep these structures really finely placed in comparison to each other. Also, because there's a lot of kind of air between bony areas, having these soft tissue structures here, that's what helps keep your guts where they need to be. So you can think of these as the soft tissue slings that support your guts when there's no bone to support your guts. Moving now anteriorly to the pubis, there is a body of your pubis, which is just the main portion of the pubis. And often, this is pretty cool, if a biofemale has had babies, there are something called dorsal pits or parturition scars, which are scars that are actually formed from pregnancy. So you look for them on the dorsal surface of the pubis. So this is actually on kind of this surface on the other side. So in here and on the other side, so basically the surface that would be facing the baby if there was a fetus in there. And these are the actual pits that are made. And this is not a one-to-one thing, so it's not like you have one pit for one baby, but women who have had, or people with uteruses who have had multiple offspring are going to have more pits than people who have only had one baby. And if you've had 0 babies, then you should probably not have any parturition scars here. So this is a cool feature that you can look for bioarchaeologically as well, that if you are trying to understand more about your population, if you find a pubis bone and it has these scars, then you know that they have survived through, the mother has essentially survived off birth. Pubic symphysis is an important part here. This is a fibrocartilaginous joint that is basically a cool joint that is in between the 2 pubis bones from the 2 os coxae, and it is not very movable for the majority of life, except for, again, during pregnancy and childbirth. Then it becomes quite a bit flexible and can actually open up quite a bit for birthing big-headed babies. The superior, or the iliopubic ramus on the superior portion has a pubic tubercle. This is the other attachment for the inguinal ligament. So the inguinal ligament comes from the ilium and comes down here to attach to the pubic tubercle. There's an obturator crest that basically is this little cresty portion that starts on the pubic tubercle. There is the pectinate, or the pectineal line, that we've talked about, as well as the iliopubic eminence that we have talked about as well. There is also the inferior, or ischiopubic ramus. So superior ramus, or iliopubic ramus, is coming from the ilium to the pubis here, and then the inferior, or ischiopubic ramus, is down here, and that's again this thin bridge or reaching arm that is attaching, that is where the pubis and the ischium meet. Reminder, the pectineal line is going to be up here, and then the iliopubic eminence is in this area here, where the ilium and the pubis meet. A little bit more about the pubis. Another feature that we look for when we're sexing a pelvic girdle is this subpubic angle that is formed by the 2 pubis bones as they are fused together at that pubic symphysis. Like the sciatic notch, it can help you with understanding if this is from a biomale or biofemale. The wider the angle, the more likely it is to be from a biofemale. That again is, the more space you have, the more space there is for baby heads that are big. So we already talked about one composite feature of the whole os coxa, but another is this obturator foramen. I guess we talked about it too. The obturator foramen, this heart-shaped foramen here, and the acetabulum with the acetabular fossa and the lunate surface. So these are all features that we've talked about already. These are all basically, they require sort of all 3 bones to be fully formed there. So you see them when the entire os coxa is fully ossified. Articulations, they each articulate with the opposite os coxa at the pubic symphysis. They also each articulate with the sacrum at the sacroiliac joints, and they articulate with the femur at the acetabulae, the femora. Ossification-wise, this is endochondral ossification. There are 3 primary centers of ossification, each found in ilium, ischium, and pubis. And there are many secondary centers of ossification. 2 in the iliac crest, 1 for the anterior inferior iliac spine, 1 for the ischial tuberosity, 1 for the ventral rampart of the pubic symphysis. Ventral rampart means basically the most ventral portion. There are multiple for the acetabulum. So the ossification of the entire os coxa is quite complicated, but the reason we think about it, again, the reason we think about it in these 3 different bones, ilium, pubis, and ischium, is because each one has a primary center of ossification, and because of evolutionary history in different species and different taxa, these remain separate bones from way back. Fusion, again, is pretty complicated. The ischium and the pubis fuse together to form that ischiopubic ramus between about 4 and 8 years. These will eventually fuse with the ilium at the acetabulum, during adolescence. And the non-acetabular epiphyses will begin to ossify as early as age 10 and fuse from somewhere between 16 and 23 years. So basically the main kind of meat of your os coxa is done ossifying by the time you reach adolescence or puberty, and then some of the edges, the non-acetabular edges or bits, can take it up into your 20s. To identify, it's of course a large bone that has a flat blade and a deep hip socket. Really the trickiest thing is occasionally you might need to distinguish it from a scapula. The ilium is thicker, it has more rounded borders, and the scapula is basically thinner and doesn't have any internal spongy bone, whereas the os coxa does. And the acetabulum is much deeper and larger than the glenoid fossa. It also has that acetabular fossa in it. And so even if you have a broken chunk of a kind of pocket-shaped articular surface, the acetabulum has that acetabular fossa, and the lunate surface can help you tell the difference as well. Siding is fairly straightforward. If you orient it in standard anatomical position, what you're doing is putting the iliac crest up and the ischium down and toward you. So you are holding it as if it's in your own body. The internal or medial aspect has that auricular surface for the articulation for the sacroiliac joint, and the external or the lateral surface has the acetabulum on it. In this position, the acetabulum is on the side from which the bone comes. So which ligament is attached to the pubic tubercle? Sacrotuberous ligament, sacrospinous ligament, or the inguinal ligament?